Greetings from Indian Journal of Anaesthesia. I, Dr. Kiran, am going to present an article published in the April 2024 issue of IJA. The article is on the effect of perioperative intravenous lidocaine and esketamine on the quality of recovery and emotional state of patients after thyroidectomy. It is a randomized double-blind controlled trial. Post-thyroidectomy complications can lead to physiological and psychological alterations that will impede the post-operative recovery of the patients and hence prolong their hospitalization. Nowadays, measures are taken to improve the post-operative negative emotions and promote enhanced recovery after surgery. Perioperative IV infusions of lidocaine and esketamine are known to reduce the levels of post-operative pain. But only few studies are conducted on the quality of recovery and patients' emotional state post-operatively when these drugs are used in the perioperative period. The study was conducted with the primary objective to measure the impact of intravenous lidocaine and esketamine on post-operative quality of recovery in patients who underwent thyroidectomy. And the secondary objective was to assess the levels of anxiety, depression, pain, perioperative use of opioids and propofol, and occurrence of postoperative nausea and vomiting. Ethical approval was taken for this study, and the study was registered in the year 2021. It is a randomized, double-blind controlled trial where the treating anesthesiologist and the patients were blinded. The patients with ASA physical status 1 and 2 in the age group of 18 to 65 years who were posted for thyroidectomy were included in this study. Whereas the patients with BMI of more than 30, severe cardiopulmonary liver or kidney disorders, diabetes mellitus, and neuropsychiatric disorders, allergy to the study drugs that is lidocaine and esketamine, uncontrolled hypertension and hyperthyroidism, pregnant and lactating women, patient on long-term sedatives, analgesics, or alcohol consumption, who are unable to understand the content of the study, a change in the intraoperative surgical approach, a duration of surgery more than 3 hours, or non-return of the patient for the post-operative visit, these patients were excluded from the study. A total of 137 patients undergoing thyroidectomy were randomized into 3 groups. Group L, which is the lidocaine group, Group E, which is the esketamine group, and Group C, which is the normal saline placebo group. All patients were pre-oxygenated for 3 to 5 minutes and a standard anesthetic approach was used, where IV induction was done using midazolam, propofol, fentanyl, and rocuronium. And maintenance was done with IV infusions of propofol and remifentanil along with additional doses of IV rocuronium. In the group L, the patient received 1.5 mg per kg bolus of lidocaine 10 minutes before induction, followed by an infusion of 1.5 mg per kg per hour until the closure of the skin incision. In group E, the patient received esketamine bolus 0.25 mg per kg 10 minutes before induction, followed by 0.25 mg per kg per hour infusion until the end of closure of skin incision. In group C, the patient received equivalent volumes and rates of 0.9% saline using same application scheme as in group L and E. The patient were discharged from the recovery using the Stewart scoring criteria. And in any patient, if the numeric rating scale for pain score was more than 5, IV tramadol was used for postoperative pain. The primary outcome was studied using the quality of recovery 40 score, which was done on the postoperative days 1 and 2. Whereas the secondary outcomes, that is anxiety and depression, were studied using self-rating anxiety scale and self-rating depression scale. The scoring was done on days 1 and 2 after surgery. Pain scores were measured using the numeric rating scale at time points 1 hour, 2 hours, 6, 12, 24, and 48 hours after surgery. The perioperative use of opioids and propofol was studied, and the levels of postoperative nausea vomiting was seen. Now, the sample size was determined using the quality of recovery 40 difference of 6.3, which was considered clinically significant, and hence 35 patients were needed in each group for the study. With an anticipated follow-up loss rate of 20%, a total sample size of 135 patients was determined. SPSS software 26 was used for the statistical analysis, which was done using one-way analysis of variance, Kruskal-Wallis, and chi-square tests. The demographic and surgical characteristics were comparable between all the groups. Now, as we see the global quality of recovery 40 scores and the subscores which are taken in 5 dimensions, there was a statistically significant difference between the group lidocaine and esketamine when compared with the placebo. That is, in the group lidocaine and esketamine, the recovery scores were higher on postoperative day 1 and 2 when they were compared with the placebo or the normal saline group. Similarly, the recovery scores were higher in the subdomains of physical comfort, emotional state, as well as pain when these groups were compared with the normal saline or placebo group. When looking at the secondary outcomes, the levels of anxiety and depression were lower in the group lidocaine and esketamine on postoperative day 1 and 2 when compared with the placebo, and these differences were statistically significant. The pain scores were lower in the initial 1 hour, 2 hour, 6 hour, 12 hour study period, and this was a statistically significant difference of group C when compared to the lidocaine and esketamine group, whereas there was no difference seen at 24 and 48 hours. And also there was no difference seen in the lidocaine and the esketamine group when seen for the recovery scores, the anxiety depression scores, or the NRS scores. Coming to the perioperative parameters, the intraop usage of remifentanil was lower in the lidocaine and esketamine group when compared to the placebo group, and the PONV was significantly less in lidocaine group when compared with the placebo group. Now, esketamine and lidocaine infusions during surgery have positive effect on improving the quality of recovery, and they can also improve the patient's anxiety and depression in the postoperative period. Improved mood can be attributed to the analgesic effect of the lidocaine and the antidepressant effects of esketamine, which happens through its effect on the glutamate neurotransmission, synaptic structural modifications, and augmentation of serotonin, norepinephrine, and dopamine signaling pathways. Due to the analgesic effects of lidocaine and esketamine, less remifentanil was consumed intraoperatively, and lower incidence of PONV in both the groups were related to this lower intraoperative opioid use, reduced pain stimulation, and gastrointestinal recovery. Therefore, perioperative IV lidocaine and esketamine in patients undergoing thyroidectomy improved their quality of postoperative recovery, the emotional state of the patients, and also reduced the level of postoperative pain. Thank you.